Everything you need to know about uterine fibroids. Uterine fibroids are growths made of smooth muscle cells, fibroblasts, and other material that grow in or on the wall of the uterus. Fibroids may grow as a single tumor or in clusters. In many cases, a single uterus contains many fibroids. Fibroids can be different sizes or shapes. Bunches or clusters of fibroids are often of different sizes. Fibroids can grow, shrink, or remain a constant size over time. Healthcare providers categorize fibroids based on where they grow. Submucosal fibroids grow just underneath the uterine lining and into the endometrial cavity. Intramural fibroids grow in between the muscles of the uterus. Subserosal fibroids grow on the outside of the uterus. Some fibroids grow on stalks that grow out from the surface of the uterus or into the uterine cavity. These are called pedunculated fibroids. What are the symptoms of uterine fibroids? Many women have no symptoms of fibroids. However, uterine fibroids can cause uncomfortable or sometimes painful symptoms, such as heavy bleeding or painful periods. Anemia, when you don't have enough red blood cells. Bleeding between periods. Feeling full in the lower abdomen, belly. This is sometimes called pelvic pressure. Frequent urination, caused by a fibroid pressing on the bladder. Pain during sex. Lower back pain. Reproductive problems, such as infertility, multiple miscarriages, and early onset of labor during pregnancy. Obstetrical problems, such as increased likelihood of cesarean section. What are the risk factors for uterine fibroids? Fibroids usually grow in women of childbearing age, and research suggests that they may shrink after menopause. However, research also shows that they are more likely to shrink in postmenopausal white women than in postmenopausal black women. For African American women, fibroids typically develop at a younger age, grow larger, and cause more severe symptoms. Several factors may affect a woman's risk for having uterine fibroids, including the following. Age. Older women are at higher risk than younger women. African American race. Obesity. Family history of uterine fibroids. High blood pressure. No history of pregnancy. Vitamin D deficiency. Food additive consumption. Use of soybean milk. Factors that may lower the risk of fibroids. Pregnancy. The risk decreases with an increasing number of pregnancies. Long-term use of oral or injectable contraceptives. What causes uterine fibroids? We don't know what causes uterine fibroids. Evidence suggests that multiple factors play a role in their growth. Although exact causes are unknown, research evidence suggests that any or all of these factors might play a role in the growth of uterine fibroids. Genetics, e.g., genetic mutations in the MED12, HMGA2, COL4A5, COL4A6, or FH genes. Estrogen and progesterone. Growth hormones. Micronutrients, such as iron, that the body needs only small amounts of in the blood. For instance, a deficiency of vitamin D may be associated with uterine fibroids. Major stresses. It is likely that fibroids are caused by many factors interacting with one another. Once we know the cause or causes of fibroids, our efforts to find a cure or even prevent fibroids could move ahead more quickly. How are uterine fibroids diagnosed? Unless a woman has symptoms, it's likely she does not know she has uterine fibroids. In some cases, though, healthcare providers find fibroids during a routine gynecological exam. During this exam, the healthcare provider checks the size of your uterus by putting 2 fingers of one hand into the vagina while using the other hand to press lightly on your abdomen. If you have fibroids, your uterus may feel larger than normal, or it may feel irregularly shaped. The size of the fibroids does not seem to be related to the severity of symptoms, so even small fibroids may cause considerable symptoms and heavy periods. If you have symptoms but your healthcare provider cannot feel any fibroids during a manual examination, he or she may use one or more types of imaging technology, machines that create a picture of the inside of your body, to diagnose uterine fibroids. Some common types of imaging technology are ultrasound, which uses sound waves to form the picture; saline infusion sonography, which uses an injection of salt solution into the uterus to help create the ultrasound image; Magnetic resonance imaging, MRI, which uses magnets and radio waves to create the picture. X-rays, which use a form of electromagnetic radiation to see into the body. Computed tomography, CT, or computer-assisted tomography, also called a CAT scan, which scans the body with X-rays from many angles to create a more complete picture. What are the treatments for uterine fibroids? Treatments for fibroids include the following: medication-related treatments, hysterectomy, other treatments. This page also includes information about emotional support for living with fibroids. Your healthcare provider will consider several factors before recommending a treatment for your fibroids, including your age, your general health, how severe your symptoms are, where your fibroids are located, the type and size of the fibroids, whether you are pregnant now or want to get pregnant in the future. If you have uterine fibroids but have no symptoms or problems, you may not need treatment. You can ask your healthcare provider to continue to check the fibroids at your routine gynecological exams to see whether they have grown. If you are close to menopause, your healthcare provider may find that your fibroids are shrinking, which is common during and after menopause.